Why is it that men struggle to go to the doctor? Is it because of fear? Is it because of a concern of what the outcome might be when they do visit the doctor? Today I want to talk to you about 4 conditions that is so important to diagnose early in men. Number 1, we'll start off with a young gentleman. Testicular cancer. That is something that the young guys get, in your early 20s, even late teens, and it's very easy to detect. It's literally a case of you just feel the testicle itself, and if there's anything in the testicle that feels really hard, almost like a smartie, it's hard, it feels completely abnormal, you need to get it checked. It's not difficult to detect. Lots of times you might feel soft things and lumpy things, but if you feel something that's really hard and it's painless, then you've got to get it looked at. Secondly, I want to talk about prostate cancer. Prostate cancer is something we get in older men, mostly from 50 upwards, and it's something that you can really detect early. There's a blood test called a PSA that you can do annually. Remember, the test is not specific to cancer only, so it's not the only thing you can do, and that's why having a rectal examination, especially over the age of 50, is really important. And I've got a very good friend that's just over 50, and he was diagnosed in January. Luckily, he went early and he was treated. He still had to have an operation, but it literally saved his life. So those things are important, and if you diagnose that late, it can have really negative consequences. Thirdly, I want to talk about erectile dysfunction. Erectile dysfunction is something not talked about much, but it can definitely ruin relationships. It can cause a lot of stress and depression, anxiety, and it's something that happens actually quite early on sometimes in life. And it can be caused by smoking, it can be caused by diabetes, it can be caused by stress, by cardiovascular disease. So if that is you, if you have a problem with an erection function, not maintaining an erection properly, then get it looked at. It's so easy to give you something to treat that. There's a medication that you can use that really improves the blood flow and will make a major difference. And it's not something that should have a negative impact on a relationship or a marriage. So please talk about that. Go to your doctor, go to your GP, go to a friend, and really discuss it. You'll be surprised how many people struggle with this. And fourth and lastly, I want to talk to you about the testicular function that produces testosterone. So testosterone is something that is very high when you're young, but it gets lower and slowly gets lower as you get older. But you get men that can get really low testosterone levels, and that's often to do with a lack of exercise. It's to do with stress levels, and a lot of situations in our modern lifestyle that can make your testosterone levels go low. It can really cause emotional symptoms. It can cause weak muscle strength. There's really things that you need to know and that you need to check. So those things are easy to screen. It's a very straightforward blood test. If you're not well, if you feel not like the normal way, the way you should feel, go to your doctor, have these things checked. At least start with a blood test. Speak about these things. There are solutions, and the most important thing, it needs to be diagnosed early. So people perish because of a lack of knowledge, and I've realized that it's actually the fear of the outcome of the test that is crippling men all across the globe. So please do not be fearful. Get some knowledge, get information, get tested, go to your doctor, speak about the problems. It can be fixed. Thank you.